Everyone, welcome to the podcast. Hi, I'm Gwyneth Cruz and I'm going to be your host for today's podcast, Kwentuhan with Hope PH. I wanted this to be something that would help you guys get introduced to our advocacy, something that would give a taste what to expect for the rest of our advocacy. The whole premise of Kwentuhan with Hope PH is to answer some of the relevant or timely questions regarding to COVID-19 today or COVID vaccines. And so the way that we are going to do this is I actually have a list of questions right now, and I'm going to be getting insights from my team, these people in front of me right now. Okay, so first and foremost, try to introduce yourself one by one, starting with Alodia.
Hi, I'm Allyssa Bantugan and I hope you will enjoy watching our podcast.
Hi, I'm Allyssa Bantugan.
Hi, I'm Francine Mae Mallillin.
Hi, I am Calzada.
Hi, I'm Quinee Aquino.
Name is Jullan Sebastian as Leano.
Now, I am going to ask questions. First question that I have right now is it true that when the FDA approves a drug, it means that the institution is certain that the drug is safe? Quinee, what are your thoughts on this?
When the FDA approves a drug, it means that the institution is certain that the drug is safe and effective for its desired use, and the potential advantages outweigh the cost when used according to the product's accredited labeling. The drug authorization is structured, and it includes gathering clinical data and presenting an application to the FDA. This also applies to the vaccines used to combat the spread of COVID-19.
And question, why should you get vaccinated even if you might get the COVID-19 anyway?
Like all vaccines, COVID-19 vaccines are not 100% effective at preventing infection. However, COVID-19 vaccination significantly lowers your risk of severe illness, hospitalization, and death if you get infected. It also protects not only you, but also the people around you.
Okay, for Quinee, are the COVID-19 vaccines safe despite their rapid development?
Although COVID-19 vaccines were developed quickly, vaccine research and development has been ongoing for decades. To ensure COVID-19 vaccine efficacy and safety, all vaccine development steps were taken, including clinical trials, authorization or approval, in which before the vaccines are made available to the general public, the U.S. and the Food and Drug Administration or the FDA examines lab results. The FDA determined that the three COVID-19 vaccines met the FDA standard and granted them emergency use authorizations external icon or the full FDA approval and tracking safety with vaccine monitoring devices.
For Allyssa, a lot of people are wondering, is Omicron variant more severe than other COVID-19 variants?
There is a reduced risk of hospitalization for Omicron compared to the Delta variant, but the World Health Organization warns that it should not be dismissed as mild.
This question right now is actually crucial, very crucial. So, do you agree that the government should make vaccination mandatory? Basti, what are your thoughts on this?
Do you agree that the government should make vaccination mandatory? For me, yes, because it is the protection that we need against the virus, to prevent the virus from spreading further, and if you are infected with the virus, its effects will not be fatal.
Same question, Faith. What do you feel about the government making vaccination mandatory, as well as the regulations like no vaccine, no ride policy?
I think it's just the right thing for the government to require us to get the vaccine, as this is for our own sake and for our own health. However, for the no vaccine, no ride policy, I think we should restudy the regulations of this policy, as there are some people who have complications in health that prevents them from getting the COVID-19 vaccine.
In this time of pandemic, you're all aware that there are many media platforms that spread awareness, like Hope PH. And what can you say as a member, Alodia?
Generally speaking, I am pleased and so happy to be part of this platform addressing vaccine hesitancy. And I am more glad that many people, particularly the youth, engage with this kind of programs. For me, it's only proving that humanity prevails during the pandemic. Just a brief background, choosing this kind of concept was not easy for us. But did you know what kept us going? It is our life experience. Like me, at first it was shaky. I am undecided whether to take the vaccines or not. But thankfully, I am surrounded with people who are willing to further elaborate to me the importance of vaccine. That is why our group chose to not stay silent about this issue. Instead, raise awareness to those people who needs our help.
Or Francine, what can you say about the myth that taking vaccines would cause people to die or shorten life?
I think we can avoid that kind of impression or doubts because we are new to this kind of disaster. It is not like a flood, earthquake, and landslide. In that case, we know what to do and how to take actions. Despite the overwhelming proof that the COVID-19 vaccinations are safe and effective, many people still have worries and reservations about them. It's vital to discuss the need for vaccinations with vaccine-hesitant friends and family members to stop the pandemic.
Next question I have right now is, in the election that was held, a lot of people say that COVID-19 will increase and there may be a lockdown. When you heard this speculation, how did you feel or what did you feel, Alodia?
To be honest, this speculation is not new for me. I already heard this being tackled in our family. However, I guess they have a point. COVID-19 cases are likely to increase, especially after the May 9 election. In fact, the Minister of Health has issued a warning that COVID-19 infection could increase sharply by mid of May. But I think there is nothing to worry about as long as we have been vaccinated. From the very beginning, we already knew that the vaccine was the only preventative measure against the virus. So I am confident and thankful that all of my family members were already vaccinated. And I continue to hope that by this time, we already realize how important vaccines are.
So, a lot of individuals, indeed the majority, have received the vaccine. And now that almost 6 months have gone, we are eligible to take the booster shot. So, Basti, can you tell me what are the risks of getting a booster shot?
What are the risks of getting a booster? Adults and children may have some side effects from a COVID-19 vaccine, including pain, redness, or swelling at the injection site, tiredness, headache, muscle pain, chills, fever, or nausea. Serious side effects are rare, but can or may occur at any moment.
For Faith, if we need a booster, are the vaccines working?
Yes, COVID-19 vaccines are working well to prevent severe illness, hospitalizations, and death. However, public health experts seem to see the reduced protection over time against mild and moderate diseases, especially among certain populations.
So, before we move on to our last question, I just wanted to say that if you haven't had the opportunity to take the booster shot yet, I'm just going to inform you and the audience that if it is allowed, please take the booster shot because the additional dose of vaccine intends to lengthen protective immunity. Notably, when there is indications or scientific proofs that vaccines protection lessens over time. Okay, so last question. If you're one of our frontliners, what can you say to those who are scared and unsure about taking the vaccine shots or the booster shots? Francine?
Many people continue to have concerns and doubt about the COVID-19 vaccines despite the overwhelming evidence that they are safe and effective. It's essential to talk with the vaccine-hesitant friends and family about the need for everyone to get vaccinated so we can end the pandemic. However, the way you speak with a vaccine-hesitant person makes a big difference in helping them decide to get vaccinated or not. Shaming or arguing does not work. Instead, listen to their concerns, give them facts, and then let them decide because they are just scared because of disinformation and fake news. So let's help them understand what's what and what is not.
Thank you for that. Since that is the last question, I am very honored and happy to have you guys here. I hope you guys and the audience learn something and enjoy our conversation. This is it for today's podcast. I hope you like it, and if you want to see more, like and follow our Facebook page, Hope PH. So thank you, and we'll see you again. Goodbye.
Down, yeah. I've been feeling so down, yeah. Can you tell me why? Can you tell me why I'm down, yeah. No friends of mine around, yeah. Now I'm thinking I might have caught the June.